Hello, my name is Paul Smith. I'm a former registered nurse from the Fort St. John ICU and the Nanaimo Regional General Hospital in Nanaimo. I have severe PTSD from healthcare, and we are in the middle of a global health emergency. For me, this is 24/7 extreme exposure therapy where people are dying, where people are being put on ventilators. And when I see it in the news, when I listen to our politicians, I get extremely triggered. This is an open letter to Dr. Herny, Dr. Theresa Tam, Dr. Ted of the World Health Organization, Premier John Horgan, Premier Andrew Furey, and Prime Minister Justin Trudeau. I need help. I need help enough that I'm making a video and showing the world what this pandemic is doing to me. WorkSafe BC, before this pandemic started, agreed that I could move to St. John's, which I am desperately trying to do so that I can get cancer treatment, so that I can get my heart assessed. In Nanaimo, the psychiatrists, all three of them, but especially the first two, stopped assessing me at 6 years old. And then they misdiagnosed me. They put me on inappropriate medications at extremely dangerous dosages. Dr. Tam, as a registered nurse, I can tell you that I look to the Health Canada logo to know that that research is safe and has been extremely scrutinized over. It is trusted information. So when Health Canada itself says Cipralex, the maximum dosage is 20 milligrams, and I have psychiatrists putting me on 40 milligrams, there is a problem. The psychiatrist then went on to say we have people on 60 milligrams and 80 milligrams. We also know from the research that medical marijuana is treatment for PTSD. We know from the scientific literature that it decreases suicidal ideation, which I have proven multiple times on Twitter as I have gotten very severely triggered and had a small puff and then been better. WorkSafe BC is lying. They are being unethical. And John Horgan, with Bill 9, third reading, you smiled as you omitted nurses. The situation in British Columbia is quite desperate because we have the Site C Dam, which should never have been approved by John Horgan, but he approved it. The BC UC report on page 14 indicated that there are geological concerns, and in 2013, BC Hydro started paying a total of $1 billion to Morneau Chappelle. Morneau Chappelle is the legal firm owned by Justin Trudeau's former Minister of Finance, and I am very thankful to the Prime Minister of Canada for getting rid of Bill Morneau. 2013 was still the year of the Harper government, where I was being subjected to mental torture in that ICU. The Fort St. John ICU was the first ICU to go 100% on a Pyxis system, which will take me too long to fully explain here. I am the nurse that constantly wrote the patient safety report saying that this was a dangerous system. I met with my MLA, who refused to offer me a second nurse on shift. I was working alone in isolation, and with isolation, I do not mean infection control isolation like our brave nurses are doing right now with this pandemic. I mean, I was alone, and I maybe saw a doctor for 15 minutes of my shift of 12 hours. Other than that, there are multiple shifts, and the majority of the time where I did not get breaks. I went 12 hours without being able to pee with the door closed, with a system that refused access to doctors-ordered medications for my ICU patients. WorkSafe BC this year has cut me off of my EMDR treatment, which is eye movement therapy that with me as a patient is incredibly successful. I am deeply concerned about the status of healthcare in Canada, and I am horrified by the actions of the Conservative Party as of late. Prime Minister, I am begging you with my life to help me get to St. John's so that I can actually have a medical team that listens to me. I am begging you to do what you said about Omar Carter and now hold the British Columbia fully accountable for the ongoing mental torture. I am begging you for my life and a chance to survive. This pandemic is hitting me extremely hard. It is relentless exposure to the triggers of my disability while I am trying to be forced back to working in healthcare. Do you think I have the capacity to work in healthcare when I don't even have the capacity to understand how we have a justice system that allows nurses to be subjected to violence when the British Columbia law says we have violence prevention regulations, and a nurse died from a kick to the throat in my ICU, and Bill Morneau's company covered this up under the Harper government. That happened in 2010, and 4 years they did not follow the legally binding regulations according to British Columbia law. I have been targeted by John Horgan and the BC NDP and the British Columbia government because I am the nurse that has advocated for nurses to have PTSD presumption, but we don't have anything in place for when we are unable to return to that profession. I have Michelle Rempel standing up in the House of Commons screaming, just be a lab tech. What part of how I am acting right now, which is raw, unfiltered, and not acting, makes you think I have the capacity so much to be a grocery store clerk in the middle of a global health emergency? I am begging the House of Commons to relocate me to St. John's. I am asking the BC government to relocate me to St. John's, where PTSD Buddies is a peer support group, where I've been in contact with Premier Andrew Fury and the Chief Medical Officer, Dr. Fitzgerald, in hopes to get an actual specialized team of doctors and nurses to treat a nurse with severe PTSD from healthcare. I shouldn't have to go make a video and beg for my life to get help. And if a registered nurse or former registered nurse cannot get psychiatrists to listen, what hope do the public have during this pandemic other than to have their concerns brushed off? I had psychiatrists refuse to listen to any nursing trauma and over-medicate me dangerously. Additionally, there is grave concerns about doctors refusing medical marijuana in Canada because we have access to a very safe medical supply of marijuana in Canada. It has been argued, and the Supreme Court has ruled in favor of medical marijuana treatment for patients. In fact, the doctors are forcing me to take a less effective treatment in medications that don't work, and the medication side effect this summer was a suicide attempt. It is not even appropriate medications for PTSD according to the latest scientific research that I was on. They had me on 2 conflicting medications. I showed up at your town hall asking for help, and now I am begging Canada to help me. Please help.